ahead and record starting now. Okay, so we are all set.
Okay, so good afternoon. My name is Aurimar Ayala, and I am the Epidemiology Manager for the California Tribal Epidemiology Center, or CTEC, which is housed within the California Rural Indian Health Board, or CRIB. So the objective of today's training is to provide an overview of case investigations and contact tracing. So this is our training agenda. I'm going to start with providing a very brief COVID-19 background. Then we're going to discuss the definitions for case and contacts. Then we'll go over the case investigation procedures, contact tracing procedures. We will also discuss some interviewing techniques. And then at the end, we're going to talk about why are case and contact investigations important for tribes. I just want to mention the scope of the training because we only have a couple of hours for this training. There's a lot of things that I will not have time to discuss. So we're really focusing on field case and contact investigations on tribal lands from the public health perspective, and we're going to be focusing on community transmissions. So this training is not intended for infections acquired in the healthcare setting. For example, if a healthcare provider becomes positive for COVID-19, I will not be covering those types of scenarios. Although I will mention personal protective equipment very briefly, this is also not a personal protective equipment or PPE training. And I will also not go in details on COVID-19 testing. However, if you're interested in more information on COVID-19 testing, or you're interested in more information about infection control for COVID-19, feel free to reach out to me. And at the end, you'll see my email and contact information. CRIB does offer more specific trainings in those areas, so we can certainly provide more training if you're interested. So now I'm going to be talking about COVID-19. COVID-19 has a very wide range of symptoms that can range from mild to severe. Symptoms may appear 2 to 14 days after exposure to the virus. And these symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, and this is kind of an important one because it's kind of very specific to COVID-19, sore throat, congestion or runny nose, vomiting, and diarrhea. So these are all the symptoms that we have been able to identify so far, and every once in a while a new symptom is added depending on the information that we're gathering from the field. I should say that some people that are infected with COVID-19 can also be asymptomatic, meaning that they have no symptoms, and we've seen a lot of those as well. So now to the COVID-19 infectious period. Somebody can be infectious 48 hours before onset of symptoms, all the way to 14 days after onset of symptoms. And I'm going to be referring to this infectious period a lot during this training. So it's really important to understand this because a lot of the contact tracing is done around this period of infectiousness for COVID-19. So 2 days before onset of symptoms, all the way to 14 days after onset of symptoms. Most people can be most contagious when they are the sickest, and the incubation range for COVID-19 is 2 days to 14 days. So how contagious is COVID-19? For each sick person, how many subsequent people will be infected? And each disease or illness has a different number. And if you take a look at this, we have examples of Ebola, swine flu, HIV, smallpox, and measles. And measles is extremely, extremely contagious. So the information for COVID-19, we're still gathering it, but it seems to be somewhere between 3 to 5. So it's a little bit more than swine flu and probably less than smallpox. But it's still a contagious disease, and yeah, somewhere between 3 and 5 is the most recent calculation that I was able to find in the literature. So just this is an overview of transmission for an infectious disease. It usually starts with an imported case, somebody that comes from a different country, or somebody that comes from a different state, or a different county or a different city. This person travels to a community and starts usually maybe spreading illness in the household environment to other household members or close people. And then these people go about their daily routines in their lives, and they may continue to spread this in the work environment, in school environment, or in any religious activities, for example, and so forth. So it continues to spread throughout the community. And the whole process of case investigations and contact tracing, the goal is to stop the spread of this disease. So now let's talk about the definitions of what is a case and what is a contact. So a case is an individual who has been confirmed to be infected with a communicable disease of concern. In this case, is COVID-19. So what I'm trying to say here is that you need to have a laboratory confirmation in order to consider somebody a case for COVID-19. And for contacts, these are individuals who may have been exposed by a case to the disease of concern, in this case COVID-19, but they have not been confirmed to be infected with the communicable disease of concern. So a confirmed case meets confirmed laboratory evidence, detection of SARS-CoV RNA in a clinical specimen using a molecular amplification detection test. So I will not go into details about the different types of tests, but usually your NP swab will give you a confirmation. If you're doing the Abbott test and you have a positive, that is also considered a confirmed case. However, I just want to point out that there's some limitations to the Abbott test. It's definitely not indicated for asymptomatic individuals. And if you have a negative test with the Abbott test, it could be a false negative. So if you're in doubt, you may have to repeat that test, the negative ones. The positive ones, they're definitely confirmed cases. So if you're doing testing for COVID-19, hopefully you'll have a communication plan for communicating results to the people that you're testing at your clinic. So once a case has been identified, before initiating a case investigation, the provider should notify the patient of the result and discuss isolation measures with the patient. So ideally, this is the best practice. I know sometimes this is not possible, particularly in some counties where they're very highly overwhelmed with the levels of cases that they're seeing and the very high transmission. But if at all possible, a case investigator should not be the first one to notify a case about the results. That should be happening from the provider. So now I'm going to talk about case investigation and what are the goals of this process. Case investigation is the identification and investigation of patients with confirmed diagnosis of COVID-19. So when I say investigation, it's within the context of public health. It's not to be interpreted as a criminal investigation by any means. And what we're doing is gathering comprehensive information on a patient with COVID-19. So we're going to be focusing on things like the date of symptom onset, the specimen collection, the gathering or eliciting the contacts, and So we're trying to identify those close contacts, and I'm going to talk in a minute about this, but we're trying to elicit the contacts for this case, and also trying to identify the exposure source for the case. During this training, I'm going to really focus on identification of contacts, so I will not be covering the exposure source for the case because of the time constraints. But I will mention that for the exposure source, you're usually just trying to figure out if this person has been in contact with another COVID-19 confirmed case. So we could link this case to another case, or if they have been in close contact with anybody with symptoms consistent with COVID-19. So some of the special considerations for case investigations, one of the critical components of the case investigation is really identifying that symptom onset date, which is the first day of any of the symptoms that I show you that are associated with COVID-19. So we want to narrow that down as specific as possible. So if a person tells you, well, I first got sick 2 weeks ago or a week ago, you want to narrow that and identify that specific date in order to be able to establish quarantine procedures. So it's a key piece of information, and you want to take your time during the investigation, making sure that you carefully define that date and that you feel strongly about this is the onset date. There are times where people are asymptomatic, so if they're asymptomatic, you will not have an onset date, and I can tell you how we will deal with that later during the presentation. So another thing I want to mention is that although you may have available information from the medical record about the case that you're interviewing, you should verbally confirm all this information with the patient. So you can use the medical record as reference, but you still are going to verify the information with the patient directly. So do not assume that the medical record has accurate information. And again, we're going to start contact tracing 2 days prior to the onset of symptoms, all the way to 14 days after onset of symptoms. And once you identify the names of the contacts, you want to obtain their phone number, full name, the email address, their house address, all the information that you can gather so that we can then contact these contacts. So case interviews can be done in person or they can be done by the phone. Most people are doing phone interviews, but I'm covering both scenarios because there are times when a person, particularly in a tribal community, may not have a phone. So you want to have an alternative of a protocol or procedure to reach out to people who don't have phones. So there are advantages and disadvantages of this, of both in-person and phone interviews. When you do an in-person interview, you're able to elicit more information from the case. You can make assessments of the home isolation circumstances better because you're there to observe the household and the household dynamics in person. It is definitely more time consuming to do an in-person interview. It requires personal protective equipment or PPE. So it also involves more of a risk of exposure to the people conducting the interview. And it really depends on the resources available and feasibility for your community and your jurisdiction. But I will say that a case without a phone number, it's somehow you need to do that interview somehow. And there are other ways that you can reduce risk of exposure. For example, you can have walkie-talkies and go to the household, but provide a walkie-talkie to the case, and then you can conduct that interview at a distance. You don't have to go inside the home of the person. So phone interviews, which is what most people are trying to do for COVID-19, are faster, they're cheaper, less cost, less risk of exposure to the case investigator. However, it excludes people without phones. You're potentially excluding lower economic status individuals in your community. And overall, this may create health disparities and inequities. The quality of the information collected over the phone is diminished. You can get better quality in person, but sometimes this is the only feasible alternative, especially when you have a lot of cases and if you are short with PPE or the staff that you have feel uncomfortable wearing PPE. So this is just to go over the contagious period. As discussed before, it's 2 days before onset, all the way to 14 days of onset. So let's, for example, say we have a case whose onset of symptoms is April 10. You're gonna be asking detailed information for April 8 and 9, 2 days before, trying to elicit those close contacts. And then you're gonna move forward in time 14 days. Now the caveat here is that say you're doing the interview on April 12th, for example, you're just gonna, if the interview day is April 12th, you're only asking about that day, April 12th, and asking about April 11 and 10, 8 and 9. Obviously you wouldn't be asking about future things. So it would just be whatever happened before the day of the interview. I'll also say there's another caveat. I have heard of people in some jurisdictions not asking for periods where people were placed in quarantine or isolation. So I want to advise against that. My advice is that even if people tell you I was in isolation or quarantine, I would still advise for you to ask detailed activities during that period, because in my experience, I have found many people actually don't follow quarantine and isolation guidelines, and you can identify additional contacts by asking for detailed information for those days. So that has personally happened to me on multiple occasions, where I just press a little bit harder with respect and empathy, but I still ask, and I am able to identify additional contacts, even during a period where the person was either in isolation or quarantine. So I just want to take a minute to define quarantine and isolation. I think there's a lot of confusion between these terms. Quarantine ensures that people that may have been exposed to coronavirus are monitored to see if they develop symptoms. And isolation avoids spreading coronavirus by separating people that have it from the people that do not. So the way I think about this, and it helps me, is quarantine applies to contacts because they are not confirmed. They may have been exposed, but they're not confirmed COVID-19 cases. So quarantine applies to contacts. Isolation applies to cases, which are confirmed COVID-19 cases. So when you use these terms, think about contacts, quarantine, isolation, cases. So COVID-19 cases should be placed in isolation. Hopefully you have a medical provider or your medical director should be in charge of placing somebody in isolation, and also if you're going to end the isolation period or you're ending a quarantine period, it should probably be coming from the medical director or a healthcare provider. That decision should not be placed on a case investigator. So there's different criteria for ending isolation, but I just want to say very briefly that the criteria for ending isolation, if not in a healthcare setting, it includes if a person has not had any fever for at least 72 hours without the use of medicines to reduce fever, and the person's symptoms have improved, and at least 10 days have passed since their symptoms first appeared, then you can release or end the isolation. So bottom line is about 10 days, and but again, you should be working with a healthcare provider or your medical director. So I want to talk about assessing self-quarantine support needs. And this also kind of applies to isolation as well. There's a lot that when you're placing somebody in quarantine, things that you need to consider, and that your team that's doing the case investigations and contact tracing should be aware of. So you're placing somebody in quarantine for 14 days. So since the last time they were in contact with a case during the infectious phase. So when you're placing somebody in quarantine, somebody should be assessing the household circumstances, because ideally you want to place somebody in quarantine or in isolation in a specific room, separate from others in the household, separate even from pets in the home, and hopefully with access to a separate bathroom for their own use during the period of the quarantine or the isolation. So it's always good to ask about the settings of the household, how many bedrooms, how many bathrooms, how many people are living there. And if you identify, for example, let's say you have a very large group of people living in a household with only one bathroom and very limited amount of rooms, that it's preventing the contact or the case to be able to isolate from others, you may want to arrange for a hotel or some sort of alternate site for isolation or quarantine. So most jurisdictions have these things already in place, arrangements, and they have identified specific locations where they can place people in isolation and quarantine outside their own households. But this is something you definitely should be thinking about before engaging in case investigations and contact tracing. So you should have this set up ahead of time. And something else to consider is addressing the environment of the household. Is it going to be safe for this case or for this contact to be isolated or quarantined? So I'm thinking of like domestic violence situations or any type of abuse or physical violence in the home. Those are very sensitive topics, but you want to try to address these topics with your during your interview with a lot of respect and empathy for the person that you're speaking with. You also want to ask them about food and water and other considerations, anything that could be a potential barrier for them to successfully stay at home during 14 days or for them to successfully stay at home for 10 days. So any barriers, and again, your team should have a protocol or a system to provide food, water, and medications to these individuals if they express this to be a barrier for them. And most jurisdictions already have some sort of setup for this as well. So I saw this from CDC. It's the COVID-19 quarantine kit suggested kit. And I want to go over this because I think it's important to have some sort of kit that you can offer. This is going to depend on your jurisdiction and your resources, but it's a good idea to offer them a face covering, gloves, digital thermometer so that they can take their temperature every day and let you know what's their temperature. Alcohol-based hand sanitizer, soap, an EPA registered household disinfectant, instructions for cleaning and disinfecting their home. At a minimum, I think the educational materials should always be provided, and some sort of number or hotline that they can call if they need support during the self-quarantine period, including medical support. So they definitely need a number that they can call if anything happens and they have a need. So now I want to talk about the difference between a casual contact and a close contact. And for this procedure, what we're focusing on is close contacts or high-risk contacts. So it's important that you really learn this definition. A close contact is currently defined by CDC as anybody less than 6 feet away from a case, so less than 6 feet, for at least 15 minutes or more. So if you're very close to somebody physically for at least 15 minutes, close from a confirmed case of COVID-19, then you would be considered a close contact, or also having direct contact with infectious secretions. So for example, if a case being coughed on by a COVID-19 case, that would be considered a high-risk contact. So example of high-risk contacts are healthcare employees without PPE. Hopefully this is not happening, but if it does, if you have a healthcare employee without PPE, that would be a close contact. All household members are considered close contacts. So when you're doing interviews, this is the low-hanging fruit. You always want to ask about household contacts because those are definitely high risk. And if somebody traveled, an example of a high-risk contact would be passenger seated within 1 or 2 seats away, so very close to the case. Those will be high risk. All these contacts, like I said, should be placed in quarantine for 14 days. Now, I want to talk about low-risk contact, and the reason why I'm bringing this up is because sometimes people get confused and they start eliciting and following up on every single person that came in contact with a case. So there's no need to do that really. We're focusing on the high-risk ones, the ones within 6 feet away from at least 15 minutes. So somebody that just walked by, unless they were coughed on, but if you just walk by for a few seconds, that is not considered a high risk. That would be a low risk. So a healthcare employee with PPE would be low risk. A passenger on the same aircraft but being seated away, it's also low risk. And if you share a closed space for less than 2 hours, it should be low risk. So there's 2 different types of follow-up that are recommended for high risk and low risk. For high risk, you would do an active follow-up, and for low risk, you can do a passive follow-up. And I'll explain what this means. So active follow-up would be for those high-risk contacts, and this is where you would actually call this person, contact them directly every day for 14 days after the exposure. So these contacts are called actively by you every day to ask for the symptoms and make sure that they're doing well and nobody has developed symptoms. So a passive follow-up for those casual contacts or low-risk contacts is where you just advise them to contact you. They self-monitor for symptoms, and you tell them, well, if you develop any symptoms in the next 14 days, symptoms that are consistent with COVID-19, please give us a call. And that's all that it requires. So this is an overview of the process that I'm trying to describe to you. It starts with the confirmed COVID-19 case at the top, and again, means a laboratory confirmation. So your MP swab procedures should cover that. And then once you have a confirmed COVID-19 case, hopefully a healthcare provider, physician, or somebody that you have assigned and have trained in communicating laboratory results will communicate these results to this patient. And also hopefully somebody will discuss the isolation guidance and instructions for them. Ideally, again, a healthcare provider. And so after this happens, then you're giving this case to a case investigator, and the case investigator will call them to arrange for an interview, ideally a phone interview if at all possible. And then this interview is going to be conducted, and it's going to be a very in-depth interview process where we're looking for two main things. One is to elicit the information on contacts, who this person may have been in contact during their infectious period. So again, 2 days before onset date, all the way to 14 days after onset date. And also to elicit information for potential exposure sources. So during this training, I'm focusing on all these mustard-colored procedures here. We will not practice the potential exposure source. So I'm gonna go more in detail on the eliciting the contacts. So during the call, you're gonna elicit contacts. You should elicit enough information to be able to classify them as low risk or high risk. So you're asking questions about how close were this person to you and for how long. So again, 6 feet or closer for at least 15 minutes. And then you're gonna ask the questions about how to contact these contacts. So you're getting their phone, their email, their address, and then you're gonna call them, all these contacts, the close contacts, and you're gonna ask them about how they're feeling, if they have developed any symptoms. You're gonna place them in quarantine for 14 days, and you're gonna tell them if they're close contacts, you're gonna tell them you're gonna be calling them every day to check on them. So some special considerations for interviews. If the case you're interviewing is a minor, minors require verbal consent from a parent or legal guardian. If a minor is less than 12 years old, it will require a proxy interview, meaning that you can interview the parent or the legal guardian and ask them the questions about the child, because they're too little to be able to answer your questions. However, if this person is older than 12, a teenager, you can ask the parent or legal guardian if it's okay for you to directly interview the teenager, because they should be able to provide answers to the questionnaire. If a patient is hospitalized, you can still interview the person. If the person is too severely ill and they're unable to answer questions, then you can do the same as with the minors, which would be a proxy interview. You can interview the husband or the wife or the parent if it's a child, and you ask them questions about the case. So after the case interview has been completed, you should now have a list of contacts, and now you can proceed to contact the contacts, usually by phone. So I'm just gonna go over this slide here. I'll take my time to explain it, but it's again describing the process. And the whole goal of contact tracing is finding cases quickly so they can be isolated to reduce the spread of illness. So I'm gonna start with this person here at the top left. So say this is a contact to a case. This was the case, it's a confirmed case, and a confirmed case is in isolation. So this person is a confirmed case, it has been isolated. These are 4 different situations of contacts that we can see. So in this first case, this person is in quarantine awaiting test results. If this person in quarantine, you get the results back and they're positive, then this person becomes a case. So then it's a confirmed case, you're gonna put them in isolation, and then you're gonna do a case interview on this person, and you're gonna elicit the contacts, and it continues, this process continues. in this example. So in this second contact to this original case, you call them every day, you follow them for 14 days. This contact never shows any symptoms. So after 14 days, this contact is no longer at risk of developing COVID-19, and you can release them from quarantine, and that process is over. This third example is an example where you contacted this contact, you call them, oh, so this is a missed contact, sorry. So this is the example where you fail to identify a contact. So if you fail to identify a contact, then this person has not been reached out and they can continue spreading illness. So the training that I'm giving today is to really enhance your ability to not miss contacts. We don't want to miss any contacts because then the spread continues. And then this last example is a contact shows symptoms, it's positive. Once the contact becomes positive, you have a confirmed case, you isolate them, you're going to interview them. And in this situation, it says here that no additional contacts have been identified, so no further spread would occur. Now, I have to say that I have yet to find a case that has no contacts. So I've never seen this in real life happening to me personally, and I've been doing this for 25 years. So if you're properly doing your interview, a person will always have a contact somewhere. So this is really rare. Now, this happens a lot. People often miss contacts. So I have seen this because I have done an interview after somebody has done an interview and I do it, and then I find a lot more contacts. If you're very thorough in your interview and you really create empathy and trust during the interview, people will share a lot of information with you. Okay, so now contacting contacts. So this is kind of different from the isolation when you're contacting the cases, because I'm assuming that when you contact the case, somebody has already discussed their results and somebody has discussed with them isolation. But when you're contacting the contacts, the contact tracer may be the very first person talking to this person. So you're going to notify them about their exposure to a positive case. And I want to say that when you're doing this notification, we usually try to protect the privacy of the case. Unless the case explicitly told you it's okay to share their name, if they say it's okay, you can do it. But if they didn't agree to that, you should not be releasing the name. And I have some scripts that we provided with this training that you can use to kind of approach this scenario without releasing any names. When you're contacting the contacts, you're going to ask about the symptoms, if they have experienced any of the symptoms of COVID-19 and symptom severity. If they have the symptoms, then this person, you can start a case investigation. You should definitely arrange for laboratory testing and see if you have a confirmed case. Again, if this is a close contact, you're doing active follow-up, so you're calling them daily for 14 days to check on their symptoms. If it's a low-risk contact or a casual contact, you're doing passive follow-up, so all you need to do for this group is just to suggest to them, you just give us a call if you develop symptoms. When you're talking to the contacts, you should be discussing quarantine. What does that mean? You know, don't leave the home. You shouldn't be receiving any visitors. You should then be asking about the household conditions and, you know, how many bedrooms, how many bathrooms can you stay in your own bedroom and use your own bathroom. Discuss cleaning and disinfection of the household, and discuss if there are any barriers for quarantine, like food, water, medication, and consider if you need to move this person or relocate them temporarily somewhere else so that they can successfully do the quarantine. If no symptoms develop after 14 days, the contact can be released from quarantine. So I'm going to very briefly talk about personal protective equipment, but again, the caveat is that this is not really a training for personal protective equipment. So I recommend, if you need assistance with this, please request an infection control training, which we can provide separately. But in a nutshell, anybody doing in-person interviews should have a gown, gloves, goggle, or some sort of face shield, and an IOSH-approved N95 respirator. So this is just kind of like the basic PPE for COVID-19. And of course, there's a procedure for putting on the PPE and taking out the PPE, so it's very detailed, which is why I'm suggesting that if you're going to do any in-person interviews, you should definitely have a more in-depth training on this topic. If you're scheduling a visit, you should make sure to request that the interviewee wears a surgical mask for the day of the visit. And again, the PPE should include the gown, the gloves, the eye protection, and the respiratory protection N95. Hand hygiene should be performed before putting on the PPE and after removing PPE. PPE should ideally be put on outside of the home before you enter the house. You should also ask if there's an external trash, so that when you leave the house, you can take out your PPE outside the house and put it in this external trash. Definitely nobody should be taking PPE into their personal vehicles. So this is just a very brief summary of PPE if you're going to do an in-person interview. So now I'm going to be discussing interviewing techniques. So 10 basic rules for interviewing. Do a practice run of the questionnaire until you feel comfortable. So the more you practice, the better you will be. Find a quiet place to conduct your interviews. So if you're doing this over the phone, you yourself find a quiet place for you, but you also ask the person that you're interviewing to find a quiet area, private area for them to talk to you. Tell them that this interview is going to take at least 30 minutes to an hour. So ideally, they're going to commit to discuss their COVID-19 illness with you for at least 30 minutes in a private area. Definitely be non-judgmental. Avoid leading the responder. You want to accurately record what people are telling you, so be a good listener. Ensure confidentiality. Make sure that you tell them that their names are not, you're going to do your best not to release their names to their contacts if they don't want that. I should also point out that this is information that you're gathering as part of public health activities. So names of people should not be released, for example, to law enforcement. So if you're participating in a meeting with others that are not part of your public health team, such as law enforcement, you want to make sure that you're not releasing any identifiable information. And I have been part of some meetings where I have felt that people that are invited to these meetings are not part of the public health team. And I will always make a point to ensure that I cannot release any information about the cases or the contacts from people outside the public health group. So during the interview, you may need to redirect as needed. It often happens that people may start talking and they kind of deviate from the questionnaire. So you want to have a kind of a polite way of bringing them back to the questionnaire. If any answers are vague, particularly about the time symptom onset, you want to probe for more specific answers. And so try as hard as you can to define that onset date specifically. If answers are inconsistent, you can always clarify answers to make sure that everything is consistent. So don't be afraid to do that in a respectful manner, but still try to clarify any inconsistencies. There should be a method for obtaining language interpretation services if needed. So hopefully your jurisdiction has that available. And you should always thank the interviewer at closing and explain how the information will be used so that they know what's going on. So when you start the interview, you tell them why you're calling and you explain the purpose of the interview. And throughout the interview, you explain why you're gathering information or what's going on in the interview. So I'm gonna, at the end of this training, I will interview somebody and you'll get to see an example of this. So before the interview, always review the COVID-19 basics, gather all the materials that you'll need, such as the pencils. You can print extra copies of the interviews, have a notepad, explain what you're doing and why you're doing it. Try to be confident. So practicing ahead of time helps, and also the more interviews you do, the more confident you become. Try to be conversational, try to stay within the questionnaire. So don't start talking about other things, try to focus and stay within the questions in the questionnaire. Definitely show empathy. The person that you're calling can be pretty sick or they can be very scared. So take those things into consideration. And I mentioned this already, but definitely probe for specific answers if responses are vague. Let them ask you questions. So you always want to pause and say, do you have any questions for me? And take your time to address their concerns and their questions. If you don't know the answer to something, then tell them you're going to get back to them with the answer, and definitely follow up with finding the answer for them. And express gratitude during the interview. So try your best to accurately record what people are telling you. You may need to be persistent to get this job done. If somebody, for example, refuses a question, you can ask, why are they refusing? If you're trying to schedule an interview, you may need to call multiple times and different times. So you may have to call in the evening, call the weekends, call the morning, call the afternoon, call after hours. Just try different attempts to make sure that you're following up. If you're handwriting the answers, make sure that you write legibly because somebody will have to read them. Try your best to fill out all the fields in the questionnaire. And again, clarifying questions if something is inconsistent. So case interviews are in-depth interviews, and we'll get to practice and you'll get to see the form, but you're gathering a lot of information. They do take time, and like I mentioned, at least 30 minutes to an hour. So when you're doing these types of interviews, you need patience, you should be going slow. You're going to get a detailed daily account of events in a person's life. So it's almost like a diary of 2 days before onset all the way to the day of your interview. So you have to do this very carefully to avoid missing contacts. Because if you miss a high-risk contact, that contact can become a case, and then you're not really stopping the spread of illness. So this is why it's important to do your best to identify all the high-risk contacts. Sometimes you may have to re-interview a case, or you may have to call them and revisit some answers. So this is something you can tell them at the end of your interview. You know, thank you for your time. I may be calling you again to ask for clarifying questions so that they know that they may be called again. And like I said, it's very common for inexperienced contact tracers to miss contacts, which is why we're going to be practicing today to ensure that you're really comprehensive in that interview and you don't miss any contacts. So this is an example of what we want to do when you're eliciting contacts and what we should be avoiding. So what you want to do is ask day by day, starting 2 days before onset of symptoms to 14 days after onset of symptoms, what were your activities? So in the example that we had, which April 10 was the onset date, you want to ask for daily activities, social gatherings, birthday parties, work activities, sport activities, any spiritual religious activities, starting on April 8, April 9, all the way to 14 days after. For each activity, you're looking for people that are high risk for contacts that are high risk. So you're gonna have to ask questions to identify the risk. For example, how close were you and for how long? So again, more than 6 feet, low risk. Less than 6 feet, for at least 15 minutes, then that's high risk. What you want to avoid is just asking a general question like, have you been in close contact with anybody since you were diagnosed with COVID-19? Yes or no. If you do this, you're going to very likely miss a lot of contacts. So you still need to do this day by day diary type of procedure. So these are some of the tips that I think are helpful to jog people's memories and help you figure out dates and people. People can go, you can suggest for your case to use their phone contacts and review the contacts that they have in their phone. They can take a look at Facebook. It is always important for you to have your own calendar. So I suggest that if you're doing an interview, make sure that you have a calendar and that you give the case time to find a calendar themselves, because that's going to help a lot with the interview. And bring a notepad. I also had a case once that actually went through all their text messages. So that's another thing that they can do. They can look at the text messages and that kind of jogs their memory as to what they did and who was potentially in contact with them during the infectious period. So now I'm going to briefly show you the case investigation scripts and the contact tracing scripts and the case investigation forms and contact tracing forms. All of this has been provided to you in preparation for this meeting. I want to say that those are your forms and you can edit them, add, delete as you see fit. Also, if you're working with collaborating, say, for example, with a county, your corresponding county, the county may have their own forms, but most people are gathering very similar information. So even if you're using a different form, chances are the information is going to be almost identical. So this is an example of a script for a case. So you could say at the bottom here, I'm calling because you tested positive for COVID-19. We're trying to gather more information about your illness and your activities before and after you became ill to aid in our understanding of this disease and to prevent future cases. So this would be a phone call. So you could say, is this a good time to talk to you? And if they say no, then you can ask when is a good time to call you, and then you call them on that different time. So this is the COVID-19 case investigation form that we have developed, and it's targeted towards tribes and tribal health programs. So for example, it gathers information on whether the person is a tribal resident. I want to point out that race ethnicity is also something very important, that if you're doing this case investigation, please make sure that you gather this. So I'm just going to go over the case investigation form. It's very detailed. In the fields highlighted in yellow are very important fields. It usually starts with demographics, so you start asking people their name, where they live, their phone, their race, their ethnicity, their employment, occupation, if they go to school. And then you're gonna ask them about their symptoms, and this is where you're gonna take your time to really carefully determine the onset of symptoms. Now, what if you don't have onset of symptoms? What if the person is asymptomatic? How are you going to proceed with the 2 days and 14 days if you don't have an onset date? Well, so what I suggest, if there's no onset date, and you just make sure that you read all the symptoms, and it's a no, 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 no to all the symptoms, then this person is truly asymptomatic. And I'm saying this because sometimes you start reading and then somebody says, oh, wait, I have this, change of taste and smell. I did experience that. And so that would be a symptom. So make sure that you read that before you determine that somebody's asymptomatic. But if they are, then you want to work with the date of the collection of the sample that was positive. So not even the result date of the lab, collection date of the lab that was tested and it was positive. So you want to use that collection date. So you're going to ask 2 days before collection date of the sample that was positive and 14 days after the collection date. So that's what you do if you have an asymptomatic individual. Okay, so now we ask them about their demographics, we ask them about the symptoms, and then you're gonna ask them about predisposing conditions, which can make them more likely to have severe illness. So you're gonna read them all this entire list and ask them if they have anything. Then you're gonna document the collection of the sample date, and then you're gonna ask them for some indications of illness severity. So you're asking them if they were hospitalized, if they were admitted to the ICU, any mechanical ventilation or intubation that was required. So this is the part that I'm not going to be rehearsing today because of the time limitations, but this is where you would be asking or trying to identify sources of infection. So who may have this person been in contact with that gave them COVID-19? And you'll see these tables starts with the 0. The 0 is the onset date. So again, it's very important to know the onset date, and 0 would be the onset date. And for trying to identify source of infection, you would go back 14 days and ask about travel, ask about social gatherings, ask if they know that they were exposed to somebody that was COVID-19 positive or somebody that was ill. So this is how this works, but today we will not practice this. This is what we will practice today, which is the identifying the exposed contacts. Again, we're focusing on high-risk contacts. So we're trying to identify the people within 6 feet or less for 15 minutes. And 0 is the onset date. And so you're asking -2 or -1, that just means 2 days prior to the onset date. So you're going to be asking 2 days before onset date, and then you're going to move all the way 14 days after onset date. And say your interview is happening on the 4th day, then you'll stop here because that's the day of your interview, so you don't have to do the future things. So this is the process that we're going to be rehearsing and practicing at the end of the training. And when you get the names, you want to get the names, you want to get their phones, you want to get their emails. You may want to gather the age and gender of the person. And I can say that household contacts, never forget about the household contacts. Those are high-risk contacts for sure. You can have a discussion with your case during the interview and suggest that they actually talk to their household, obviously their wife, their children. They can talk to them and tell them themselves, but you still are going to have to call them and talk to them. So you can give the option to the case to talk to their family members, and then subsequently you contact them and do the interviews. So this is the contact investigation script. Again, you can modify this as you need and depending on the situation. But for example, you would be saying, as part of an investigation into a confirmed case of COVID-19, and note that we're not releasing the name of this person. So as part of an investigation into a confirmed case of COVID-19, we're following up with individuals who may have had contact with the case while they were possibly contagious. We're calling to check on you and discuss some public health recommendations with you. So this is an example of something you can say when you're calling contacts. And again, just a reminder that close contacts, you're going to be calling them daily for 14 days. So this is the form that we're providing for contact follow-up. You can edit it, you can add more information if you want to. It's up to you. But basically, there's a space here to document the number of attempts that you're doing to talk to this individual. And these are just a list of the symptoms, COVID-19 symptoms that you would be asking them if they have developed any of the symptoms. If they have developed symptoms, then this, you should arrange for testing, and you would be switching to a case interview, and you would probably be placing them in isolation. So I'm going to talk briefly about data management, meaning the information that you're collecting from the case interviews and the information that you're collecting from the contact tracing follow-ups. So I'm sure many of you have heard there's a lot of contact tracing software out there that has been developed in response to COVID-19. So some of the contact tracing software names are like ComCare, Qualtrics, SaferMe, Sarah Alert, and Accenture. There's also contact tracing modules that state health departments or counties may have available. And there's database software also that you can use, like Access, EpiInfo, and others. I'm gonna say that at a minimum, you should have an Excel tracking sheet. And we do have 2 Excel tracking sheet templates that can be provided to you. One that can be used for the case investigation information, and the other one that can be used for the contact tracing information. So a lot of this contact tracing software is really developed for when a community has or a jurisdiction has thousands and thousands of cases. So for example, the California Department of Public Health may be using Accenture because they have thousands of daily cases. So it provides a way to manage large volumes of cases, very large volumes of cases, and very large volumes of contacts. Although some of these software like Sarah Alert can be free, Accenture and Qualtrics, for example, can be quite expensive. So my recommendation is that if your community has less than 100 cases, that's not a very large volume, you can easily manage that in Excel. So I would not be recommending any contact tracing software. Having said that, if you're interested, we have a table where we have detailed the prices and some of the limitations and the benefits of different types of software for contact tracing, so we can provide that technical assistance as well. But again, Excel should suffice, and we can provide templates. So it is best practice to consult with a senior epidemiologist with expertise in contact tracing to set up the tracking sheets and databases. Managing your data can be key to success of contact tracing because investigations can quickly become complicated with many contacts. So you do want to ensure that you have something to enter the data that you're collecting. So now to the topic of why are case and content investigations important. So when you're investigating cases, that investigation will provide information on how to set up the home environment to be safe for the case and other household members. So we talked about making an assessment of the household and the conditions of that household. You're going to be able to identify individuals who may be best housed in a location other than their own home. And you're going to identify possible needs for resources or support, such as the food, the water, or the medications. And cases in isolation should be monitored and watched for disease progression and needs for medical care. So you definitely want to ensure that you have a system where the cases in isolation are being monitored for any needs that they may have. So for contacts, during this process, you're going to identify individuals who should be quarantined. You're going to provide information on how to monitor for onset of symptoms. And you're going to provide information on how to prevent infecting family members and other community members. So again, this whole process is about stopping the spread of COVID-19 and keeping those in the community that are the most vulnerable safe, such as keeping elders in the community safe. I will briefly now talk about the framework for case investigations for tribes. So we're proposing a framework that's culturally based outreach. We think that tribal members or individuals that are part of the tribe are going to be more likely to reach individuals. If they know their community, they can be better at having adherence to quarantine and isolation, and having just a better understanding of the cases and the contact situation if they're from the same community. So we think that tribal data collection can be more accurate, more complete. It definitely gives ownership to the tribe of their own data and more control of the data from the tribe. And it gives more access to the tribal government for decision-making information. So this is a framework that we propose. It's a collaboration between the tribe, the tribal health program or clinic, and the corresponding county Department of Health. So I want to say that It is the decision of the tribe if they want to do their own case investigations and contact tracing, so they can decide that. But if they don't decide that, the county health department definitely has a responsibility to provide resources and services to the tribe. So at the very least, we always recommend that the tribal health program work closely with the county, that you meet with them and that you agree on the procedures for case investigations and contact tracing, so you know which role do you have and who's doing what. And CRIB is coordinating for different meetings to enhance this collaboration. And if you are not part of the meetings, you can always reach out to us, and we'll definitely, as part of CTEC, we can provide support and advocate with you, with the county, for resources and coordination. So this is kind of like what we propose the team for case investigations and contact tracing should have. Again, it should be a collaboration between the tribe, the tribal health program, and the county health department. Ideally, you want to have a public health officer designated by the tribe, or a medical director from the tribal health program or clinic, somebody of a medical director, a public health officer, and this person will provide the clinical guidance and recommendations. So you need this person because this is the person that you're gonna ask about isolation and quarantine information. So you will also need a team supervisor, which, for example, it could be somebody like a public health nurse that is gonna be leading the case investigation and contact tracing teams. And then you have your case investigators and contact tracers, who can be community health representatives, clinic staff, or others. So I'm going to talk briefly about the California Tribal Epidemiology Center, or CTEC. I mentioned when I started this presentation that CTEC is housed within the California Rural Indian Health Board. We're one of 12 tribal epidemiology centers in the United States. CTEC, as all the other techs are, we're a public health authority for the tribes in California. And so we provide COVID-19 technical assistance to tribes and tribal health programs. This is a summary of some of the available technical assistance that we can provide. We have this webinar presentation and in-depth training on case investigations and contact tracing. We also have the case investigation forms and the contact tracing form templates. We have scripts, both for case investigation and contact tracing. We have set up some databases and tracking sheets in Excel, which we can share with you and you can use. We can create automated reports for you if you're interested, using SAS, and SAS means Statistical Analysis System. We can provide support with phone call interviews for cases and phone call follow-ups for contacts. We can also provide support in data entry of the information gathered during these phone calls. And in addition, we can do mapping support, such as GIS, or Geographic Information System support. And we're always available for any phone call or email consultations to provide guidance related to COVID-19. I want to share with you our team. I named them the Rapid Remote Response Team because we try to be fast, and we're definitely remote. Our team is composed of 3 epidemiologists, 3 program evaluators, 1 research associate, 1 epidemiology manager, and that's me. and my two supervisors, Deputy Director Kathleen Jack and Director of Research and Public Health Department, Vanessa Cresci. And most recently, we have added CDC Foundation staff that can also support COVID-19 case investigations and contact tracing. So this is my contact information.